So we're going to pick up with objective number 5 in this section of chapter 13, and it asks you to know the main stages of development of an infection. And so in order for an infection to occur and progress in your body, there's basically 5 steps they have to go through. So I'm going to go through this list really quickly, and then we'll come back and expound on each one of them. So step 1 is it's got to find a portal of entry. So that microbe has got to get either into your body or it's got to get into other systems where it can actually cause infection. Once it's gotten into that area, it's going to have to attach firmly because your body's going to try to flush it out, so it's got to find a way to stay attached. Then it's got to survive whatever you throw at it, so it's going to survive the host defenses. It's finally then going to cause damage and disease, and then when it's finished with you, it will simply exit. So if we come back, again, portal of entry is your step 1, and so we're going to spend a little bit of time talking through this in a little more detail in just a moment, but you can see what some of the main portals of entry are. You can see some of the ways that the microbes are going to attach firmly, whether they use their fimbriae, those bristle-like structures. Sometimes they can use their capsule. They can use those spikes, hooks, even surface proteins to attach themselves to your body. They'll survive host defenses, so they either can avoid being eaten by avoiding the phagocytes, or sometimes they'll allow themselves to be eaten, but they don't actually get destroyed inside of a phagocyte. Sometimes they're able to evade other actions of your immune system. And then once they've done that, they can cause damage, whether it be using toxins or enzymes or making your own cells burst, as far as that's concerned. And then typically, if it was a portal of entry, it can also be a portal of exit. So they mention here on the screen just something to be aware of, that there are certain factors, and this is a table that you can find in your book. It's table 13.4. So if you flip over a couple of pages, you'll see this on page 409. So factors that will weaken your defense mechanisms. Obviously, the older that you get, things just don't work like they used to. So we see kind of an increase in infection as you become older. Genetic defects can increase chances, surgery and organ transplants. Anytime you open up your body, you're opening it up to potential infection. Immunosuppressive drugs, chemotherapy can do that. Physical and mental stress. We know that stress causes the production of cortisol levels, and high amounts of cortisol can actually suppress your immune system. So you probably have noticed that times in your life when you've been really, really stressed, those also typically become the onset of an infection or some type of illness. So one thing that we do want to be mindful of as far as microbes are concerned is that pathogens are either going to be true or opportunistic. Now, we've talked about these terms before, but wanted to make sure we came back to these really quickly. So if a microbe is a true pathogen, they're going to cause disease in anybody. They can cause disease in healthy people just as good as anybody else. And so we think about the flu. You know, the flu's not picky. The flu doesn't just go after those that are weak. The flu's going to attack whoever it happens to get attached to. Now, an opportunistic pathogen, on the other hand, they wait for the opportunity. So these are those that prey on the weak. They feed off of those compromised individuals that are already immunosuppressed, and they lead to an infection. So a lot of fungus or a lot of fungi are opportunistic. So waiting on your immune system to get suppressed so that they can lead to an infection. Now, as far as pathogens are concerned, one of the things that we consider with pathogens is we consider their virulence. So virulence has to do with the severity of the disease. In other words, their ability to establish themselves in a host and cause disease. So the more virulent they are, the more dangerous they are. Now, what the CDC does is they have actually adopted a system to rank pathogens based on their virulence. So those that fall under class 1 microbes, these are microbes that are not known to cause disease. So they're not very dangerous to us. Class 2, class 3, they get a little more dangerous. When you get to class 4, these are those that are highly contagious, they're highly virulent, and they're highly dangerous as far as the potential to cause an infection. So if we look at the microbes that we actually use in our lab, they're going to rank really low on the CDC's system. They don't allow us to get into class 3, class 4 because they don't ship those here. They don't want people to accidentally get sick and spread them. So we look at pretty low-level pathogens as far as our class is concerned. So I told you that we would come back to those 5 steps of infection. So if we go back to step 1 or phase 1, this is the portal of entry. So this is the route that a microbe uses to get into your body, into your tissues. And so some of the common ones we see are like the skin, GI tract, respiratory tract, urogenital tract, or transplacental. And so you think about all these, they have in common the fact that they're external, or they in some way open up to your external environment. So if you get a cut or a scrape in your skin, microbes can get in. GI tract, you take in food, you take in beverage, the food and the drinks that we're ingesting, they're not sterile, right? There's microbes in them. And so we ingest microbes potentially with those food or drink materials. Respiratory tract, probably the most prominent portal of entry because your nose always stays open, right? And so as we inhale oxygen, we're not breathing in pure oxygen, right? We're breathing in anything else that's mixed in the air. So there's the potential for infection there. Urogenital tract, so we think about intercourse is a way that we can get microbes into our system. And then transplacental just means that you're able to actually gain microbes through the placenta from mother to child. So a couple of vocabulary words they mention here: exogenous versus endogenous. So exo, outside; endo, inside. So exogenous agents, these are those that originated from outside of the body and lead to an infection. Endogenous, those that are already on or in your body, the normal flora that lead to an infection. Now, I did want to just quickly mention some of the major pathogen groups that are listed here. So with microbes, portal of entry, as far as the skin is concerned, the most common pathogens that enter this way are your staph, they're your strep, but we also know that HIV and some of the hepatitis viruses can enter through the skin. As far as the GI tract, we're looking for foodborne pathogens, so E. coli, Salmonella, Shigella, some of the common ones there. Respiratory tract, these are going to be those that lead to a lot of your common respiratory illnesses. So strep pneumoniae, Klebsiella, mycoplasma, some fungal infections that you can get from air. Urogenital tract, this is going to be a lot of your STDs, right? So HPV, herpes, yeast infection, also mentioned here. And then with transplacental, this is storage. So these are those infections that are commonly passed from mother to child through the placenta. So syphilis, toxoplasmosis, that's the one you get from potentially from cat feces, other, rubella, which is the German measles, cytomegalovirus, and then herpes simplex. So a lot of the common portals of entry and some of the major pathogens associated with it. So they mention infectious dose, minimum number of microbes to cause an infection. So if they have a smaller ID, that means it doesn't take much to actually cause an infection. So vocabulary term if you see that. Now remember, so phase 1 was they had to find a portal of entry. Phase 2 is that they've got to attach themselves to the host. So adhesion here. And again, just a quick list of appendages they may have in order to attach to a host cell, whether it's fimbriae, cilia, the outer layers of the glycocalyx could all be used as ways to attach themselves to the host. So then we move into phase 3, where they have to defend against your defenses. So they've got to find a way to not get killed or flushed out of your system. And so one of the ways that they do this, we kind of mentioned, is you're going to try to eat them. You've got cells that are going to try to phagocytize them and get them out of your system. And so some of the ways that they kind of avoid that is they'll secrete toxins, right? Toxin is any type of material secreted by bacteria, secreted by a cell that's potentially dangerous. And what happens is when it's secreted, it typically will kill your cells. So some pretty bad stuff with those. And then of course a lot of them, like I said, they block the phagocytic response. So they keep from getting eaten, which can be potentially dangerous with us. So once they have kind of established themselves and they've not allowed themselves to be killed, then they're actually going to cause the infection. Okay, and become pretty dangerous as far as that's concerned. So again, we mentioned toxin here, coming back to objective number 8. So these are typically chemicals, products that are poisonous, they're dangerous to your tissues, they're dangerous to your cells, they're dangerous to your organs. Sometimes toxins can be passed through the bloodstream, and if so, we call them toxemias. Tetanus does this, diphtheria does this, if you've ever mentioned it before. Botulism has the ability to do some of that. And what a lot of toxins do is they lead to necrosis, which is cell death, tissue death. So necrotic tissue, that has actually died. They also mention here the difference between an endo and an exotoxin. So endo, these are not secreted, but actually released after the host cell is damaged, or then exotoxins, those that are actually secreted by the living bacterial cell, and they're going to infect your tissues. One scary thing about some microbes is that they have the ability to destroy red blood cells, and we'll talk more about some of these a little bit later, but they're hemolytic in their ability to target blood and actually to digest it and destroy it. So almost at the end of this section, a couple other things that we wanted to mention. 4 distinct stages of a clinical infection. This is objective number 9. So really quickly, you have the incubation period, which is the initial contact to where you actually start to see symptoms. So if you ever hear someone say that the flu has a several day incubation period, Ebola has, I think it's like 7 to 10 day incubation period. So this is where it's the onset of the infection, but you don't actually see symptoms. So it's in your system, but you don't know it yet. Prodromal stage is where you actually start to show symptoms. You start to feel discomfort. You start to complaining about those types of things. Period of invasion is where you see some very specific signs and symptoms. They've become well established. That microbe has gotten in the area it wants to be in, and it is reproducing at the quickest rate possible. And then eventually, hopefully, you move into the convalescent period where you actually begin to respond to the infection, your immune system kicks it into gear, and your symptoms start to decline. Now, I did just quickly want to mention a couple of different types of infections that we see. So we see localized infections that stay in one area. We see systemic infections that have that ability to spread. We see focal, which actually is a combination of the two. So it starts out in one location, but it breaks away and moves to other tissues. You can also see mixed infections where it's more than one microbe that's actually causing that disease. We also have the terms primary versus secondary infection. So primary infection being the first infection, the initial infection. Secondary is typically opportunistic. So it's an infection that happens because your immune system was already suppressed. And then of course they mentioned the difference between acute versus chronic. So acute, everything is fast. The onset is quickly, but it's also typically short-lived as far as the infection is concerned. Chronic takes a little bit longer to deal with. Definitely lasts a lot longer as well. They also mention some terminology at the bottom of the screen that we typically associate a lot with infections, inflammation, enzinitis, right? So that's something that we talk about in anatomy as well. So last thing we want to look at in this section is we're talking about infection, we're talking about disease, we always talk about signs and symptoms. And so I need you to understand that these two words are not the same thing, right? So a sign versus a symptom. A sign is objective, a symptom is subjective. In other words, a sign is something that you can measure. It's something that you can run a test on and you can actually get a measurement. Symptoms are really just kind of a description of how you're feeling. So if we look at table 13.9, we get some good examples of signs versus symptoms. Like fever is a sign, right? Because you can you get a thermometer and you can determine if that temperature is above normal. Chest sounds, that's a sign, right? Because you can actually listen, you know what's normal versus abnormal. You can get a white blood cell count, right? So leukocytosis, leukopenia, abnormal white blood cell count. Those are things that you can actually run tests on. But if you look at symptoms, chills, pain, nausea, fatigue, those are all valid things to mention with an infection, but they're not necessarily things that you can measure. And so we call those symptoms. You'll want to be careful that you don't get those terms confused, because we hear a lot of times those used kind of in place of each other, but we need you to be aware of the fact that they are not the same thing. Okay, inflammation is your body's first response to injury, and so it mentions, as far as inflammation is concerned, we typically see edema very quickly. right? So we see an accumulation of fluid in the area, probably because your body is flooding that area with white blood cells trying to deal with the issue. Sometimes we can see granulomas and abscesses where this inflammation has kind of walled off. It can lead to swollen lymph nodes. And so one thing that I would note about inflammation, it is your body's first response to injury. Be aware that it's not always a bad thing, right? Inflammation means your body's responding to whatever is causing the issue. We can see some vocabulary words associated with the signs of infection in the blood. Just in case you ever hear these terms again, you kind of have an idea of what they are. And we'll stop there for this section.